Okay, so welcome back everyone. This is actually one of my favorite procedures, is the eyebrow lift using threads. It's actually phenomenal, it's amazing, um, and it's very, very successful. We use specifically a thread called Nova thread. This is specifically made for this and it goes under the skin. I already numbed our patient. Um, and I have already the access site. It's really simple. It goes right under the skin,
It's a little pressure.
and as you can see, there's very little discomfort. Goes as far as I can, close to the eyebrow. Then I pull the needle, and as you can see, the thread, and you push the skin over it, and there's some barbs on the inside of the thread that keeps everything hanging up over the thread. Ideally, we would like to use two, but as you can see, there's a little arch now that is forming as I'm pushing. Heather, can I have a little bit of saline?
Yes.
And that's actually the thread that we'll be cutting shortly after I'm happy with the way that thread is pulling the skin over. And as you can see, everything is moving up. And then the more I push the skin over the barbs, it stays right over the barb. Or you can use the lidocaine just to get the lidocaine for a second. I can use it just.
Yeah, I'll draw some saline out for you too.
So that's one. I like to do a lot of pulling on this because the more pull, the more it hangs up. And then you can actually see the difference now between right and left. There's a little bit of elevation of the arch. Now technically if we do two we get a lot more, but we're only doing one today. So now I'm going to do the second side, and that's basically the thread right now. And like I mentioned, I've already had the access site. And as you can see, there's very little discomfort. Once the thread is in the right spot where we want it to be, we pull. Yeah, another 4x4. And now the thread goes, the skin is pushed over the thread. This is really I think this is my second favorite procedure. Don't forget to ask me, okay? Leave a little suspense for everyone. Really, especially the eyebrow. I mean, the entire lift procedure is now really one of my favorites because, you know, non-surgically you can do, and it's the only solution. I mean, there's only two solutions for gravity. One is basically suspending the skin against gravity with those threads by pushing it over against gravity. So look at the difference right now. It's really, truly amazing. You get a little arch. It makes you look less tired and less fatigued. Again, normally I would do another one at the corner and it pulls up a little bit more. We can do that, but today we're only for the. Okay, I need the scissors, please. Okay, so we're getting those scissors. Just leave those for a second, and so we'll be back in maybe a few minutes to show you how we do the threads for the mid face against gravity. Those are the larger threads, and then we go to pull up everything up here. So we'll be back in a second. In with the sutures for the face, we're gonna do a suspension by lifting some of the skin all the way up. We'll be suspending against gravity. Typically we do between 2 to 3 sutures on each side. One to lift that jowl upward this way, and the other one is to lift the nasolabial fold upward, and then by both of them we'll just pull back and just give her a little lift and flattening of the nasolabial fold. That's really a good treatment for what we call mid-face sagging. And again, this is a treatment for gravity. Let me take the first one, please. So we start with the top one. Again, it goes under the skin. And it's tunneled really easily. Very little discomfort. This is a procedure that I guess that is done with just local anesthesia. We are where we need to be, right in the mid-face. Just a touch more. Yeah, that's it. Push it down. That's it. Now where I'm pulling here, look. You pull the skin up. And that's my suture right there. You can see the suture actually coming out here. Perfect. And this is the Nova thread. There's another kind called InstaLift, which is a little bit more, takes a little bit more time to place because it's two puncture sides. One goes medial goes, the other one goes lateral out. Because as you can see, it's starting to suspend. The tissue pulls over the barbs inside the threads and it stays up. And it's also medicated. It has a filler on top of it. So it's pretty good actually, I like it. And this one can last between 12 to 16 months. The InstaLift can last longer, but they're definitely more expensive. So I'm pulling a little bit and then sliding the tissue right over the thread. So that's one. Take the scissor. Already the pull, everything is pulling up. So the second one, we're gonna go toward the jowl. Same technique under the skin. A little too superficial. Now it's better. Feels right under the skin, and again, as you can see, it's not terribly uncomfortable. Local anesthesia. And that's it. Procedure is done. I'm done on this side. Can you spray some water from? Okay. Thanks. This is just so we can actually slide the tissue. Second thread. Again, this is how the thread looks like. It's a cannula. It doesn't really puncture. And it has a thread on the inside.
Which helps, so there's less risk of
Yeah,
bruising.
there's definitely less risk of bruising. And I'm pulling and pushing the tissue upward. There we go. Minimally invasive lunchtime procedure. Get equivalent of maybe around 6 natural surgical facelift with this, and it gets better with time actually, because the medicine that's on it stimulates collagen formation and helps suspend everything upward against gravity.
Last one. Doing good, Sam.
was feeling the thread against the skin to make sure that it's not. It's going exactly in the direction I want it to go. Now that I have it where it needs to go. Okay. More. Just a touch. Actually, I have it. I finally have enough. Okay, so what we're doing right now is just suspending the tissue, the skin, right over the barbs inside the thread. And I actually can feel it under my thumbs when I'm pushing that high. Okay? Go for a second. Just a little bit here on my finger, just a touch. This way. It's easier to suspend.
Let me push that. So it's not.
Get that down. Oh, thank you. Okay. So, I don't like to show. I know a lot of doctors, plastic surgeons are showing like a lot of bloody procedures on Facebook and Instagram, but I don't like that. So, but I want everybody to be able to see, you know, how the procedure is being done and how, you know, it's not a uncomfortable procedure. It's just under lidocaine. It's not a general anesthesia. There's no anesthesia involved except lidocaine and local anesthesia. But it's really a great alternative for people who don't want to have surgery and they're interested in having a lift. Maybe people in their mid 30s and 40s as well as late age, and you know they want to have a little bit of upward lifting. This would be a great option if you don't really want to have surgery. So how was it? Can you tell us?
It was very good.
Any pain?
I mean, a little pressure, but not pain.
Okay. So again, I mean this is a very comfortable procedure. See you guys later.
Thank you.